This conference will now be recorded.
Okay, I was muted, I guess. So all of you hopefully can hear me now. My name's Diane Henry. I'm with the State Health Department, and I'm the State RAI Coordinator and also the Administrative Programs Manager for the Keys Help Desk at the Health Department. I've been with the Health Department for 9 years, and prior to that, I was with the Oklahoma Foundation for Medical Quality and worked with them on helping the nursing homes on their quality improvement initiatives. I really have enjoyed working with all the nursing homes and partnering with you and helping you in all of this. So today we're going to talk about the 5-star quality rating system and some of the nursing home initiatives that CMS has. We'll discuss some of those as we go through.
Sometimes import the computer, maybe. I'm not sure, honestly.
Hopefully I can get this to work.
Usually when he clicks on the other screen, make sure the cursor is on the other screen first. Okay, yeah.
Okay, hopefully that will help. So our objectives today is, of course, to look at the CMS 5-star rating system. And we're also going to look at how some of the quality initiatives correlate with the nursing home compare and how that relates to you and how it can benefit you to understand these different quality initiatives. We're going to identify the components of the 5-star rating system and how they're calculated. And then we'll also look at kind of how to navigate the system if some of you haven't looked at that yet. So I want to give you just a little bit of history on the Impact Act. The background for this is for the 5-star rating system correlates with the Impact Act and how they implemented this and put it into law. It was passed in 2014, and the Impact Act stands for Improving Medicare Post-Acute Care Transformation Act. And the purpose of this is to compare quality of care with individual outcomes across different post-acute care settings. Prior to the Impact Act, or prior to 2014, when, let's say, the LTAC unit or maybe the hospital was looking at a particular assessment item versus how the skilled nursing facility was looking at it, we were not able to compare those particular assessment items because they didn't correlate. So now CMS has implemented the Impact Act, and it allows for the standardization of these patient assessment items and the data. So now we're actually comparing apples to apples. When one assessment setting is looking at functioning, then also the other settings, such as the skilled nursing facility, is also looking at the same item for functioning. This also helps us improve patient outcomes and quality of care through better care and coordination. A couple of the subcategories under the Impact Act is the Skilled Nursing Quality Reporting Program. And James, have you heard of that before?
Or skilled nursing facility, but not the quality reporting part.
Okay. So those of you that have not heard of the Skilled Quality Reporting Program, and we'll refer to that as QRP because it's much easier to say. This has to do with compliance and capturing, and it relates to certain quality measures that CMS uses to measure compliance with this. And we'll go through what those quality measures are. But basically what CMS wants us to do is report 100% of the data needed to calculate at least 80% of the MDS assessments and the quality measure. So if you're not in compliance with that, then you could possibly get a 2% reduction in your annual payment update. So that's why it's important for administrators to understand that, because it impacts your bottom line, of course. This started being publicly reported as of 2018. So it's been a couple of years now that we've had this into play. So our next slide is the actual quality measures that are measured, looking at the compliance for the SNF QRP. And you'll see here that it says at the top fiscal year 2022, and that's because it runs behind. The data that we're collecting now on the MDS assessment for 2020 impacts your quality or your compliance measure for QRP as of 2022. Okay. There's 8 current MDS-based measures, and then there's also 3 claims-based. We'll look at the claims-based in a couple of slides. So to be in compliance with the QRP, you have to, again, meet 80% of the assessment items on the MDS assessments that calculate these measures and submit 100% of that data. So an example of that would be Section K. Are you familiar with the MDS at all?
Slightly.
Slightly? Okay. So the MDS is the minimum data set, and it doesn't typically look like this. This is just one that we ordered from a company, but usually it's on the computer. It's electronic for the nursing homes. But like this is a 48-page assessment. And each of these sections talks about something to do with the residents, such as functioning or their weight or their ADLs, how they're able to get around and what help they need. So it's just painting a picture of the resident through that assessment. So all of these quality measures that we just talked about comes from how this is coded. Okay. So the bottom line with all of this, in order to get that 80%, we want to avoid using what they call dashes or skipping an item. Previously, CMS would allow nursing homes, and they still allow it, to dash fill an item if they don't have the assessment information in the chart. But now, if it's one of these measures, then you don't want to dash fill that item because obviously you want to get that 80% submitted so that you have the data, so that you don't get that 2% reduction. So an example of that for pressure ulcers, that is Section M, which is under skin assessment, but they also use Section K, which is your weight and your nutritional intake, to measure what the resident's nutritional status is, because nutritional status, of course, goes along with assessing pressure ulcers and preventing pressure ulcers. So if there's a lot of times that when residents are admitted to the nursing home after the hospital, they can't weigh, or maybe they don't feel like weighing. And so if that particular item is skipped, and it ends up being enough skipped items like that you can't calculate the measure, then that would end up being a reduction, a possible reduction. Any questions on that?
Yeah.
Okay. So there's also timeframes that you have to meet for these SNF QRP items. And you will notice that there's some asterisks on the first 2 from January through June, and that's because of the COVID, the pandemic. CMS provided a waiver that nursing homes did not have to meet the reporting requirements from January to June. But as of July 1st, they lifted that waiver, and now nursing homes are required to start submitting and making sure they're meeting this requirement. And the next deadline that you can see there on your chart is February 15th, 2021. So that data will be from the time period of July 1st through September 30th. Now, this is different than your MDS assessment timeframes because your MDS submission timeframes has to be completed like within 14 days from completion. It has to be submitted. But you've got until February 15th to meet the deadline for the SNF QRP requirement. Okay. So the 3 claims-based measures are the 30-day post-discharge readmission, discharge to community, and then Medicare spending per beneficiary. These particular measures are based on hospital claims, so there's not any additional requirements or reporting requirements, collection of data or anything like that that's required. It all comes from the hospital claims. So I always get a question, well, how can I make sure I'm compliant with the SNF QRP? And I encourage administrators to look at running these reports that I've listed here for you. If you don't have access to the CASPER reports, you may not, as an administrator, you may not, but a lot of administrators do want to have their own access to CASPER. If you do, you can just call me and I will help walk you through on how to get access. Okay? Or you can ask your MDS coordinator to run these reports for you because they will have access to all of them. If your facility goes through your corporate office or if you have a third-party billing company, you can ask them to also run these reports. But you will want to make sure that you look at the final validation report for your MDS assessments because that will show what assessments have been accepted in the system. And then look at your MDS data submission report. That submission report will tell you the number of assessments that MDS coordinator has submitted and how many were accepted and how many were rejected. So that's also a good way to evaluate your MDS person to make sure that they're doing an excellent job and not having a lot of rejected assessments. And then your missing assessment report will tell you, obviously the name says it all, it will tell you if there's any assessments that have not been submitted yet or accepted in the system. A lot of times MDS coordinators think that they've submitted it because their computer system will tell them that it was accepted. But then if they don't look at that final validation report to verify it was really accepted in what it's called the ASAP system, or the Aspen system, if it's not, if they don't get a final validation report from there to show it's in CMS's system, then they mistakenly think it was in. So to access your SNF QRP reports, you want to look at your review and correct reports, your SNF provider threshold report, and also your facility level and resident level QM reports. All of those will help tell you your compliance with the SNF QRP. So this is just a screenshot. Maybe your MDS coordinator is new and they don't really know how to find the reports, or maybe you want to look them up yourself and get your own CASPER access. So if you're interested in finding these reports, you obviously log into CASPER, and then after you go to CASPER, you click on reports at the top. And then from there, you would click on that where I have that blue arrow, SNF Quality Reporting Program. And then that will bring up all of these reports that I just talked about. And again, I'm available. Other team members is Wanda Roberts and Holly Murphy. So you can call any of us and we'll be glad to help walk you through this. Just a quick overview of what some of these reports look like. This one is your SNF QRP threshold report. And you can see over at the far right, this one is talking about pressure ulcers. See there. And then over here on the far right, it talks about the percentage of assessments meeting the compliance threshold. And then the next column is those that were successfully submitted. And then on down, it gives a further breakdown on this screen. And you can see I've got highlighted here, this particular facility only had a 92% threshold for Q2 of the calendar year that I pulled this. So if you look at the rest of the columns there, you can see that the number that was successfully submitted, resident assessments, which is again, this MDS assessment, they had 12 that was successfully submitted, and then 11 that met the threshold. So evidently there's a couple of things that could have happened on that assessment. One is they dash filled or skipped some items on that assessment, or it didn't get accepted into the system and they thought it did, or they didn't do a discharge assessment. So the last column again shows the number that was successfully completed to meet that threshold. There are some exceptions to this reporting requirement and the deadline. We just got through having that ice storm, and so some of you probably was without electricity. Hopefully, James, you didn't have that issue in your facility.
We did, but it didn't last as long as some of these other areas.
Good. I was only at home a couple of days without electricity at home, but one of my other coworkers, she was without electricity till Friday. She got it back Friday. So
It was like on and off throughout the week, so.
yeah, it was awful. But something like that at your facility that you have no control over, or a tornado or whatever comes, CMS has given an exception to that deadline. So that second bullet there just says that you've got to notify them within 90 days of the event occurring to request an extension. And you have to use the email that I've given you there. They won't accept any other form of communication. It has to be through that email. If you do happen to have an incident, hopefully you never experience that, but if you have an incident that occurs that you need an exception. So these are some of the resources, and I've given you some links here, email addresses. If you do have further questions on QRP and I'm not able to help you, then you're welcome to contact these people, these email addresses. Do you have any questions that I can answer on the SNF QRP? Okay. So the next subcategory, the next quality initiatives, is the SNF or Skilled Nursing Facility Value-Based Program. And you will hear us refer to that as SNF VBP. This became effective back in 2016, and it is, again, posted on Nursing Home Compare. And the goal of the SNF Value-Based Purchasing Program is better outcomes. They're looking at one specific measure, and it's the 30-day all-cause readmission measure. And they're looking at preventing rehospitalizations. That's the whole purpose of this goal. So if each nursing home meets the requirements, then they will receive an incentive payment on an annual basis. And these payments are given on your Medicare Part A reimbursement, so there's nothing else additionally you have to do. And any skilled facility that participates in Medicare or is under the SNF PPS is eligible for these incentive payments. And that includes the freestanding skilled facilities or even a non-critical swing bed. James, I didn't ask, what facility are you with?
River Valley and Clinton.
Clinton, okay. So you're not a swing bed then? Okay, a swing bed is a non-critical access hospital, and the CMS for these rural hospitals that don't have a lot of clinical assistance, they allow them to what they call swing their bed as far as whether it be a hospital bed or a skilled facility bed.
Oh, yeah, it's just skilled.
Okay. So the measure that, again, that they're using is the 30-day all-cause readmission measure. And that means exactly what it says. It doesn't matter why that resident had to be readmitted to the hospital. If they had to be readmitted within 30 days of their previous hospital stay, then that particular measure will be calculated for your facility. So obviously the lower readmission rates are better. We don't want a high readmission rate. The way that they calculate this measure is they look at the risk window. And I want to explain a little bit how to look at that risk window. So it begins when the patient is discharged from the hospital and then is admitted to the skilled unit within 1 day. It ends whenever there is 30 days has passed from that start of the window, or whenever the patient is readmitted to the hospital, whichever occurs first. So an example I've given you on your handouts is, let's say that as of September 1st, the resident is discharged from the hospital and admitted to the skilled unit, but then on the 10th, they have to be readmitted to the hospital. So that risk window for that 30 days started on September 1st, but it ended on the 10th because they were readmitted to the hospital. But then once they come back out and are readmitted back to the skilled unit, that new 30-day window starts over. Okay. There are some exclusions from this measure, thank goodness, because when it says all cause readmission, that even means what causing that?
Somebody's mic is on.
Oh, okay. So a couple of exclusions that I was saying regarding not being included in this measure would be if they had an additional admission to another post-acute unit, such as they went from the hospital to the inpatient rehab and then to the skilled unit. If that occurred for that resident, they would not be included in the calculation of this measure for your particular nursing home. And then also if they've had greater than 1 day between discharge, maybe they thought they could go home from the hospital, but then they got home and a couple of days, 2 or 3 days, the family says, I just can't handle them at home, so they need to go back to the skilled unit. If they've had greater than 1 day, then that particular resident would be excluded. The other exclusions include if their diagnosis for the hospital stay was a treatment for cancer, or if they were not enrolled in Medicare for the whole 12 months prior to the hospital discharge. And then the last one is if they were leaving against medical advice. If they decided they didn't like the nursing home and they wanted to leave, but the doctor said no, and they left anyway, then that would be excluded from that measure. So you want, again, look at your customer reports regarding these value-based purchasing program. If you have any questions, again, I've given you the email address here that you can submit your information to, but make sure that you don't include any identifiable, patient health information. You don't want to include any kind of protective health to CMS. Any questions that I can answer for you on that? Okay. So let's move on into nursing home compare and 5-star rating system. And again, the reason I wanted to bring in those other subcategories is because it impacts your ratings, it impacts your reimbursement, and it also is publicly reported. So all of it ties together with this nursing home compare and 5-star rating system. Have you ever accessed nursing home compare yet? Okay. I'm just going to give you a couple of screenshots here so that you'll know where to find it. When you go to Nursing Home Compare, you can just type in that in your search engine, whatever search engine you use, and type in Nursing Home Compare, but make sure you put CMS and look and click on the CMS link. Then here you just enter whatever nursing home you're interested in looking at. You can enter the name or you can enter the state or the city. So once you access it and you pull up the resident or the facility that you're wanting to look at, if you click on, you'll see there at the bottom of the screen, it'll say general information. It'll talk to you about the health inspections or any complaints that facilities had, what their staffing measures are, the quality measures, and then their penalties. So I just want to look here at quality measures. You can also see on the screen where it says special focus facilities, and hopefully none of you will ever have to deal with special focus facilities, because that is a facility that has had some trouble and they've not cleared their deficiencies and they continue to have the deficiencies. And so CMS has designated them as a special focus facility to try to get them additional help prior to having to take further measures. But you can see that it's listed here on Nursing Home Compare for the public to see. So if you click on the tab that says Quality Measures, it will bring up this screen. And I recommend that you look at the graphs because that's really gives you a good, clear picture. And where I've blacked out the name of the facility, just in case there was anyone in here that I happened to pull that facility for, it will give the facility average, it will give Oklahoma's, and also the national average. So it will give you the star rating for their quality measures and then their overall star rating you can see here. Prior to all of this data being publicly reported on Nursing Home Compare, you can pull out of your CASPA reports this review and correct report. And this actually, it says preview of quality measure scores. So I think it's about 60 days prior to it being publicly reported, you can go in and pull this report and look to see if you agree with the quality measures and your ratings. And if you don't, then you can contact CMS and talk to them about it to see what the problem is. You will see there on this slide, it says 199 on some of the measures. 199 means that there were not enough residents to calculate the measure. And so they didn't calculate it, and it's just going to be listed as an NA. Also, a code of 201 means that there was missing information. And also that's going to also be reported as an NA on Nursing Home Compare. Let's look a little bit closer as to what the stars actually mean. Obviously, the 5-star is much above average, all the way down to the 1-star, much below average. And the 3 categories that are looked at and are rated under 5-star, the first one is the health inspection. Then they also look at staffing and then quality measures. And those 3 also make up an overall facility rating. And of course, your overall facility rating is what is posted on Nursing Home Compare. So we're going to look at each one of these a little bit closer. And this first one we'll take a look at is your inspection domain. The health inspection measures are made up of what they call a cycle. And a cycle involves the 3 most recent standard surveys. It also includes 36 months of complaint investigations, and then any repeat visits the survey had to come out and do if you didn't get all of your deficiencies cleared. They will add additional points after the first revisit. So the second, third, and fourth revisit will give additional points. And as I said earlier, these three things make up what they call a cycle. And it's important to remember what makes up a cycle because we're going to look at each one of those. So each deficiency is assigned points based on scope and severity. And I have given each one of you the survey deficiency scoring sheet here. And you'll want to keep this handy because we'll be using this to calculate some of the measures in a minute. So the more points, of course, are for the more serious widespread deficiencies. The fewer the points, the less serious and isolated. There's also substandard quality of care reports or additional points. And then past noncompliance or immediate jeopardy is assigned equal to G level deficiency. So I just want to, in case you're not familiar with how to read this, because this is your survey, this is how you will get graded on your surveys. So let's look at this single handout here, the survey deficiency scoring. Most of us have probably heard of an IJ. So if you start at the top, the severity is immediate jeopardy. And then the J means it's an isolated pattern. It didn't occur throughout the whole facility. So that's why it's referred to as an IJ. And that would get 50 points. But if it's determined that it's substandard quality of care issue, it could be given 75 points. That's why it's in parentheses there. So then on across, the pattern would be an IK or maybe L if it's widespread. If there's actual harm, that's going to be considered a G level deficiency if it's not immediate jeopardy. Actual harm but not immediate jeopardy. That's lesser points. And then you can see on across as you read across the chart there. An H would be 35 and an I would be 45. Unless, again, it's substandard quality of care, then it gets additional points. Sometimes it happens that surveyors have been out and they're doing just a regular standard survey, but then someone files a complaint and later on there's a complaint survey that's also conducted. If that happens within 15 days of each other, then that's only counted once. They're not counted double, thank goodness. And also the federal surveys, as well as the life safety code surveys, are not included in the calculations. So I want to take a look at how each of the cycles are weighted, because this first cycle, which is considered the first year, because we remember a cycle includes the three most standard surveys, so the three most current years or recent years. So cycle one would be your current year. So let's just say it's 2020 and you've had a standard survey. And then they're also going to look at any complaint surveys that occurred in the past 12 months and any recent revisits. So that particular cycle for year one is going to get weighted half or 0.50 points. And I'll explain how all this is as we go. I'm just building a foundation here for you to follow. Cycle two, which would be a year ago, which would be 2019, that's only weighted 1/3. And that is the first previous survey, like back in 2019. And then cycle three is weighted 1/6, and that would be 2 years ago, which would be 2018. Okay, and then this is how they look at the repeat revisits. So your first revisit doesn't get any points. If the surveyor has to come out a second time, that's 50% of the health inspection score. A third time is 70% of the health inspection score, up to 85% of the health inspection score. So obviously, if we're wanting a lower score, we don't want a bunch of revisits because that's just going to keep adding up the points. So here's an example of how to add all of that up. So you look at your deficiency points on the cycle and you multiply that by the appropriate percentage in the revisit chart. So an example would be cycle 1, which again is your current year, had a total of 52 deficiency points, and then they had to have 4 revisits. So 52 times 0.85, because the 4th revisit gets 85%. That comes out to be 44.2. So that's revisit points are added then to the standard survey. So let's take a look at this. Let's walk through this example. So example 1, ABC Nursing Home had 7 deficiencies on their most recent standard survey, 3 deficiencies on complaint surveys in the most recent 12 months. 1 revisit had to be done to ensure that the deficiencies were corrected. So going back to this survey deficiency score chart, a standard survey under 2B would get how many points? So let's look at the very bottom row and find a B. So that's 0. Okay, so two B deficiencies still get 0 points. Yes, 5D is 20 points, so that row would equal a total of 20. So now we need to look at the complaint surveys. So they had 2 Ds. Two Ds with 8 points. And then 1E was 8, but you were getting there ahead of me at 16 points. That's okay. 16 points, so you're right. Like this.
36.
Yeah, and then your revisit points, they only had 1 revisit, so it was 0. So they don't have any revisit points. So then you add all those together. But
Right, okay.
you have to multiply it times that 0.50, because cycle 1 gets half, which is 0.50. And all of that equals 18 points. Okay? Any questions on how we came up with that? Right. So let's do cycle 2. And remember, cycle 2 is the like 2020, so cycle 2 would be 2019. Okay. So they had 9 deficiencies on their first prior standard survey, 3 deficiencies on complaint surveys, and that had to be, the complaint surveys were from 13 to 24 months ago because that involved cycle 2. But this time they had to have 2 revisits. So 3 Cs, how many points?
0. 0.
Yes. And then 3 Ds, how many points?
12.
Correct. 2 Es
16.
and 1 G.
20.
Correct. So all of that added together equals 48 total points. So now we have to calculate the deficiencies for the complaint surveys. So 1E is how many points?
8.
8. 1G,
20.
20. And then 1H, which is a substandard quality of care.
35.
Okay, it's a substandard quality of care. And remember, I told you if they determined it was that, you give them the points in the percent in the parentheses. So
So
it's
it's
40
40.
points. Everybody following that? Okay. So all that added together equals 68 points. Now they had revisit points. So you have to add your 48 plus your 68. Do you see where I'm getting 48 and 68? It's the first two. That comes out to be 116 points. And then you have to multiply that times 0.50. And if you recall, if you look back on your other slide, you have to look back and see how many revisit points it gets, and it happened to be 0.50. So when you multiply that out, it comes out to be 58 points. Okay? And then to get cycle 2 total points, it's the 48 plus the 68 plus the 58, and all that comes to be 174. And then we're multiplying times 1/3 because this is the second cycle. So it only gets 0.333, and you do want to carry it out that far when you're calculating it to make sure you get the right calculation, because if you only carry it out 2 places, it comes out to 57. So all of that equals 58 points for cycle 2. Everybody following me?
Yeah.
Okay. One more. We've got to do the third year, which is cycle 3. They had 4 Ds. How many points does 4 Ds get? 16 points. 2 Es, 16 points. And then 1 H that was not a substandard quality of care, 35 points. And then 1 K, and it was a substandard quality of care, so it's 125. You add all of that together and it comes out to be 192. And then they did not have any complaint investigations for the period of 25 to 36 months. So it's 0 points for complaints. So we're going to add the standard survey points and the complaint survey points. And since it's the third cycle or the third year, it gets calculated by 0.70. And that comes out to be 134.4. Okay, so then we take the 192, the 0, plus the 134.4 for revisit points. All of that comes out to be 326.4. And then we multiply it times 1/6 or 0.1666 because it's the third cycle year. And we get 54.4 points. Okay, now we add all of this together. And this is the steps that CMS takes in order to calculate your health inspection survey points that's posted on Nursing Home Compare. So cycle 1 had 18 points. That was our first year. Cycle 2 had 58 points. Cycle 3 had 54.4. And then all of that equals 130.4 points. From there, you have to go and look at what they call the cut point table. And this is your cut point table as of October 1st, 2020. And this changes sometimes every month, sometimes it's every quarter. It just depends on CMS. So for Oklahoma, we have 295 facilities currently. So we take our 130.4 points that we looked at, and under 1 star, it says greater than 108 points, it's going to be 1 star. So we know that this facility got a 1 star for their health inspection rating. Any questions on that? Want me to cover any of that and explain it again? Okay. So when they're looking at the health inspection rating for the state, they take the top 10%, and the top 10% of the facilities will get a 5-star rating, depending on the top 10% that got the best score. And then the middle 70% is going to be divided equally between your 2 stars, 3 stars, or 4 stars. The bottom 20% that had the lowest scoring is going to get a 1 star. So you can tell just from the way that they look at that in each individual state that if one nursing home, if their score changes a little bit in their health inspection rating, that could throw you down into the middle category when you used to be in the top 10%. So you also have to look at what your facilities in the state are also doing. That's one thing that can change your star rating, is another facility changing to either better or worse, and changing you, and it puts you into the different category. So some other things that can change would be your health inspection survey. For example, you might have gotten 5 IJs and you decide to take it to the board and you want to contest it and have a meeting about it. So it gets reduced down to 1 from 5. So that would change that health inspection rating. New complaint investigations with deficiencies, if they identify that you've got more complaints or something and they substantiate those, then that can change your health inspection rating. As the complaint ages, we saw each year we got less points that have to be used for calculation. So as it ages, it's going to carry less weight. Sometimes there's missing data on the health inspections domain. For example, you may have gone through a CHOW or a change of ownership, and there's only 2 standard surveys available under that CHOW. So they're going to use the most 2 standard surveys, and that's going to receive a 60% weight. And then the first previous survey will receive a 40% weight. If they've only had 1 standard survey since that change of ownership occurred, there's going to be insufficient data to calculate it, and so they're not going to receive a rating on Nursing Home Compare for any of the domains. Sometimes when you look at a facility, it won't have any rating, and that might be why. There's just not enough survey data. Your survey data is the most important out of all 3 domains that's calculated. Again, I want to remind you, we're using survey data, staffing data, and quality measure data. The survey data is the most important because it's the one that we start with in calculating the other 2. If you don't have a survey data, you can't calculate the others. Any questions before we move on? So let's look at the staffing domain. And the overall goal, of course, for staffing is to have better quality of care, better staffing. CMS correlates better staffing with higher quality of care measures. Inadequate staffing, or poor nursing staffing, and poor skills mix ends up usually meaning poor quality of care. So the 2 things that they could look at, 2 staffing measures, is your total nursing hours per resident day. Your total hours per resident day includes RN, LPN, and nurse aide hours. Then they also use just RN hours per resident day only. This gives, both of those added together, gives an overall staffing rating for your quality measure, for your staffing measure. So I've listed here, your RN hours is job code 7. Your director of nursing is job code 5. And then a registered nurse with administrative duties is job code 6. Your LPN hours is listed out there. If they have administrative duties, it's a job code 8, and so on. All of this is listed under what they call the payroll-based journal. You might have referred to it as PBJ. James, have you been involved in all that yet? Okay. I'm sorry to pick on you, but you're the only one I can pick on. You're gonna, all the rest of the class is gonna owe you big time. So the payroll-based journal, you'll hear referred to as PBJ, is fairly new. Nursing homes had to start reporting it. Their staffing data and payroll data as of April 2018. Previously, they reported their payroll and staffing data on Form 671, but we no longer use that. We now strictly use the PBJ system. And the reason it's much better is because it's reported more frequently, and also it can be verified back to the payroll records, because you're supposed to report the hours that were actually worked. And of course, as with other measures, there's also deadlines for submission deadlines here. You can see on your chart that the next due date's November the 14th, so that's coming up. All of the nursing facilities need to be looking at their payroll data, making sure they're getting it submitted. And that data would be from July the 1st to September 30th. That has to be reported by November the 14th. So the staffing data is based on a ratio with the resident census. So they also look at resident census, and that comes from the MDS, this minimum data set. So they look at both of those for the ratio. And then they look at the number of hours that each staff member worked, and they're paid based on that. There is also a cut rate table. And I did check, and it says April of 2019, but this is the most current one. There's not another one out there yet. So at the top of that chart, you will see where it says total nurse staffing rating hours, and that again includes RN, LPN, and nurse aide. So when you calculate those hours, let's say, for example, you had between 3.5 and 4.0, which is under 3 stars. Then they also calculate just the RN hours, which is over there to the left. So if you look at row 3, maybe the RN hours for your facility was 0.5 to 0.7. So then you go across that chart back to that number 3, and you'll see that it gets 3 stars for your staffing hours. Does that make sense? Okay. So there are some exceptions that I want to bring to your attention. If a facility fails to submit by the deadline, it's going to automatically be dropped down to a 1-star rating for your overall staffing rating and your RN staffing for that whole quarter. It's going to stay that way the whole quarter on Nursing Home Compare. Also, if you report that you had 4 or more days in 1 quarter with no RN staffing, it's going to automatically be a 1-star for the overall staffing and RN staffing. So you definitely don't want that to happen, because obviously that's going to drop down your overall star rating on nursing home compare. Just want to bring out one thing though, because of COVID, there again was that waiver where nursing homes did not have to report their PBJ data. And so as of August the 14th, facilities did have to start reporting again. So your next deadline, as another reminder, is November the 14th. There's going to be, the staffing data is probably going to be suppressed because of that COVID and not reporting. And the ratings are just going to show not available until we get caught up on all of these measures. So again, CMS can audit records. They can look at payroll records to verify the accuracy. It's much better than what it was when it was submitted on that form. Any questions on the staffing domain? So we've got the health inspection rating, we got 1 star. The staffing domain, we got 3 stars in our examples that we used. And so let's move on, and our last domain that we look at is the quality measure domain. Excuse me. The quality measure domain has an overall quality measure rating, as well as they look at your long stay quality measures. And a long stay quality measure is any resident that was in a nursing home 100 days or more or longer. Short stay is they were in the nursing home less than 100 days or 100 days and less. So again, I've got that written on your next slide, and it says long stay is greater than 100 days. And these are all of your long stay quality measures that CMS uses to calculate the 5-star rating with. There are additional quality measures that we look at for the CASPER quality measures, but these are the only ones used for the quality for the 5-star rating. And then your next slide is your short stay quality measures that they're currently using. There's only 3 of them. And then you've got a claims-based measure. And this one is number of hospitalizations per 1,000 resident days. And also if they went to an emergency department visit. Your short stay claims-based measure includes another 3 measures. Again, it's rehospitalizations, or if they had an outpatient visit while they were in a short stay, which your short stay is typically your skilled unit. And then the last measure is, were they successful in returning home or back to the community? Okay, so let's look to see how they calculate the quality measures. So again, they're based on the MDS assessment that we've talked about. And there has to be at least 20 resident assessments that's across those 4 quarters of both the long and short stay. The claims-based is at least 20 nursing home stays over the whole year instead of just the quarter. Okay, so they're going to use ratings calculated for the 4 most recent quarters. And again, looking at the at least 20 resident assessments for that whole quarter. Again, we all know that there's a missing assessment that happens. Sometimes the resident didn't get assessed, or the assessment didn't get submitted into the system like we thought. So if that happens, they're going to, CMS will use the calculation of 12 assessments, or actually to make the 20 assessments that we talked about. So they're going to, let's say that your facility has the 12 resident assessments and they're missing 8. So they're going to use a state average for those 8 assessments to come up with those 20 minimum sample size. And you really don't want them to use a state average because you want your data to be reported based on your facility. So it's hopefully, you know, each facility will have enough assessments and enough residents to calculate the measure. So there's 2 different sets of weights that they use, and they assign points again to these quality measures. There's anywhere from 15 to 150 points for these measures I've listed here, like your ADLs, antipsychotic med use. And you'll see there that I put LS, that means long stay. Long stay antipsychotic med use. And then I'm not going to read all those to you, but just be aware that there are differences in the amount of points that is assigned. The next slide here, for those 150 points and those quality measures, there's 15 points for the poorest performing, and then 150 points is the best performing. And then the second set of quality measures is your pressure ulcers, your long stay catheters, long stay falls, all of those. Again, those are only assigned 20 to 100 points instead of the 150. So 20 is your poorest and 100 is your best performing. They take this quality measure cut rate table, and you can see here on the chart where it says long stay quality measure threshold. Depending on your points that's calculated, you can get anywhere from 1 to 5 stars, depending on the points. And then they do the same thing for their short stay measures, and they add those together to get your overall quality measure rating for your nursing home compare. So we've gone through the 3 domains, which is the inspection, the staffing, and now the quality measure domain, on how they come up with the calculation for each one of those domains. Then they take those 3 domains and whatever those calculations were to get your overall star rating. So we're going to go through that. So again, as I said earlier, we're going to begin with the health inspection rating. And this is, again, the most important step. So step 2 is your staffing rating. And it can upgrade facilities that receive 4 or 5 stars for staffing. They want staffing to be very stringent because, again, staffing, the more staffing you have, the better quality of care. So you add 1 star if the staffing rating is 4 or 5 stars and is greater than the health inspection rating. Or you either subtract 1 star if the staffing rating is only 1 star. So you can see how important it is from those individual domain ratings. You can end up either having to add or subtract based on those individual domains. So your step 3 is your quality measure ratings. And again, either add a star if it's 4 or 5, I'm sorry, if it's 5 stars, or subtract if it's only 1 star. And then step 4 is your quality measure. If it's a health inspection rating, it's 1 star. The overall quality rating cannot be upgraded more than 1 star. So we're just going to walk through some of these to help make all this come together and make sense. The last step is if it's a special focus facility that's not graduated off of that listing, then the overall rating cannot be more than 3 stars. Okay, so if the health inspection rating, using those criteria that we just said about adding or subtracting a star, the health inspection rating is 3 stars, so we start with that. And then the staffing rating is only 1 star, so what should we do? You may have to refer back to, hopefully it's big enough for you to see it.
Yeah.
So if our staffing rating is only 1 star, then we're supposed to subtract a star from the health inspection. So I'm sorry, I'm looking at example 2. I apologize. Let me back up. Example 1. We've got a 5-star staffing rating, so because it's 5-star, we get to add a star to our overall rating. Okay? And then our quality measure rating is 3 stars. And it says in step 3, if our quality measure rating is 5 stars, we get to add 1 or subtract if it's a 1 star. So it's neither. So we don't do anything. We don't add or subtract. So it's just 0. Okay. So our overall rating ends up being 4 stars. Does that make sense? Okay. So let's look at example 2 that I was trying to skip forward to. So we have a health inspection rating of 3 stars. Our staffing rating is only 1 star, so therefore we have to subtract a star, right? And then our quality measure rating, again, is 3 stars. We don't add or subtract, so that's 0. So then we end up with a 2-star rating because we had to subtract that 1 star. Okay, the last example. We have a 2-star health inspection domain rating. And then we have a 3-star staffing rating. And going back to our guidelines and our instructions, add 1 star if it's a 4 or 5, or subtract if it's only a 1 star. So we don't do either because it didn't meet either criteria. So it's a 0. And then the same thing under the quality measures. It's add a star if it's a 5-star or subtract if it's a 1 star, and it's neither. So it's 0. So we end up with a 2-star rating. Okay. So did everyone follow as far as how we get each individual domain rating plus use those ratings to get your overall star rating? Okay. So I've said this a few times now as far as the health domain is the most important. The facility's overall rating can go up 2 stars, higher or lower than the survey rating. If they don't have a health inspection rating, then of course, as I said before, no other ratings can be completed. This is some other reasons why you might have a change in rating that we talked about before. You might have a change in health inspections. You might have a change in your PBJ staffing. You might have a change in your quality measures. And as I mentioned, a change in data for other facilities in the state. If other facilities' data changes, that could cause you to fall out of the top 10%. As we mentioned before, there is that monthly preview report, and you access through that through Casper. You want to make sure you look at that prior to it being posted on Nursing Home Compare, because referrals from hospitals look at Nursing Home Compare. Financial institutions look at Nursing Home Compare to look at the ratings. Of course, the consumer and the resident's family looks at Nursing Home Compare to see what nursing home they may want to go to. So it's very important to make sure that all of this data is accurate, so that you're able to get the information and the referrals that you deserve. Our department is the Keys Help Desk. There's also a national Keys Help Desk, so it's hard, sometimes gets confusing, but we're the Oklahoma Keys Help Desk with the Health Department, and that's our number that I've given you there. You can also email mdshelp@health.ok.gov, and you can submit a question, and any 3 of us will be able to answer that question. You can also email me directly. I've given that information on the last slide. This is just some resources that you need to be aware of. This is where you get Nursing Home Compare or the other Compare, like hospital, doctors, all of that. And then this is information on your 5-star rating system. If you're one of those that really like a lot of data, you can go to data.medicare.gov. It has all kinds of reports and data that you can look at if you like to play with that data. If you have questions on your report, when you pull that preview report and you don't agree with it, you want to email bettercare@cms.hhs.gov. And you only have a short time frame to do that. So make sure that you look at that early on and get that information to them so that they can get that corrected if it's wrong. This is your emails for the other 2 that we talked about today, SNF value-based purchasing and also SNF quality reporting program. I just listed them here again for you as well in the resources. And then, of course, my contact is the last page. If anyone has any questions, feel free to call me. We can help with your quality measures. We can help with MDS questions. Also, your SNF value-based purchasing and quality reporting program requirements. We're glad to help with any of that. James, I appreciate you interacting and answering my questions today. Can I answer anything else for you? All right. Well, it was really nice to meet you, and I wish you all the luck.
Thank you.
Good luck in everything. We finished early, but